So this is typical marking for 360 fat transfer. So here's the upper back here. We come up high. There's the upper back. We're going to do the middle of the back here. Then we do the waist. The waist is technically defined by the rib. This is the border of the rib. This is the pelvic bone. So this is technically the waist. Below the waist, you have what's called the hip roll. So I'll put HR there, hip roll. The hip roll extends from the iliac crest down to the upper border of the hip dip. We're also going to do the triangle, which is right there. That's part of the 360. Bra roll, so this is the bra roll area in here, so all of this is going to get lipoed. Of course, we're going to do the whole abdomen, and then the mons, which is down here. So those are the 8 areas of 360. Sometimes we have to do the inner thigh, which is here, to get a little more fat. Do the arm, which includes the whole deltoid up here, the back of the arm, you go all the way down here, and we get all this too with the arm. That is not included in the 360. A couple key frames here. When you're thinking about BBLs, think about 3 areas. This is the buttock proper, which is where the muscle sits. The muscle's beneath this. This is the hip dip area, which is colored in red. And then this is the thigh, lateral thigh. So most patients want to fill in the buttock, the hip dip. Not everyone wants thigh expansion, but we do add fat down the leg from here down to here. And what this area does here is it's going to create more of that thigh expansion, more of that curvy look. The next part is expansion. What does expansion mean? Expansion is filling. So we're going to add as much fat as we can. We're going to use a small incision down here, and then we're going to come up and start adding. The amount of fat we can add is going to depend on 2 things. One, the size of her buttock to begin with. So if you have a small buttock, less fat goes in. If you have a large buttock, we can fit more fat. It's common sense. Think of volume. The second one is skin. How much can the skin expand? How stretchy is the skin? So if the skin can expand and stretch, you get more fat in. If the skin's very tight, imagine 18-year-old patient, 100 pounds, very tight skin, healthy, it's not going to expand as much.
Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.